Good morning.
Morning.
Thank you for being here. It's so nice of you to be here for a few minutes to help us share in the official rollout of something that we've been working on as a group for several months now, and we think it's really going to improve the quality of life for people here in the Commonwealth. So thank you for being here. My name is Paul Mina. I'm the President and CEO of United Way of Tri-County in Framingham, Massachusetts, and I'm also the Executive Director of Massachusetts 211. And we're all very pleased that you're here today. HelpSteps, 211 HelpSteps is a platform that was created to allow people online, easy-to-use access to what used to be known as the 211 database and a bunch of other material that we're now adding to that database to make it more robust and more thorough for the people of the Commonwealth. The database will allow for clients, for individuals, for families, and for providers to be able to log in very, very easily, to be able to find all the information they want so they can help people in need. We're very excited about that because the whole goal of 211 and all of our programs with United Way have been always to give people access to good information so they can improve their quality of life. We, in the creation of 211 HelpSteps, which by the way is the brainchild really of Dr. Eric Fliegler, who you're going to be hearing from in a few minutes, is really a collaboration that's highly unusual. Nonprofits don't really work together very well normally. We seem to have, always find a way to not work well together. But in this case, 211, Boston Children's Hospital, the United Way, Boston Public Health Commission, and the Greater Boston Food Bank have worked together seamlessly for months to create this wonderful product that you're going to see in a couple minutes. I want to thank Eric and his team for their tremendous work over the last several months, in fact, over more than a year and a half, to create the platform. I want to thank our 211 staff and the Call to Talk staff and our United Way staff for helping them to access and then integrate the 211 database into the HelpSteps platform. I want to thank all of the people who I'm missing, who did not get named just now, for all of their help. We also have two people in the audience here today that I just want to introduce. First, our board chair is Paul Maraska here from our United Way. He's here. Without his support, we wouldn't be allowed to do a lot of these things. And my colleague, Dennis Carmen from the United Way of Plymouth County. Where are you, Dennis? Right here. He's there. He's here as well, and his organization is one of the big funders of 211. It's my pleasure now to introduce to you a good friend, somebody who's hosting us here today. You know when the banks kind of merge from one thing to another and they change their names all the time? Well, Karen's career has kind of like been that, okay? She's kind of, not merged, but she's kind of ascended. And, she was our rep, and then she was our senator, and then she became chair of Ways and Means. And now she is the highest position within the Senate, our Senate president. And I want to thank her and her team for hosting us, for supporting us for so many years at 211 United Way and our new Call to Talk mental health suicide prevention line. You couldn't have a better public servant on your side than Karen Spilka. So it's my pleasure to introduce my friend, Senate President Karen Spilka.
Good morning, everyone, and thank you, Paul, for that generous introduction. But I do want to say that I could not be doing what I do. I would not be here today and as Senate President if not for folks like you. And it's as simple as that. One person can't get stuff accomplished. It's a team effort, a team approach, where we're all working together. And as we know, sometimes it takes a while, or even years, and sometimes it can go a little faster. But we need the support of all of you and folks like you across the state. I am thankful that I represent Metro West. I believe it's the heart of Metro West, and have terrific organizations like the United Way with Paul and Call to Talk with Eileen, and I feel very thankful. Makes my job a lot easier, actually. But so I thank you all for being here, and I thank you for all that you do every single day, day in, day out. Thank you. So let me say that on behalf of the Massachusetts Senate, it really is a pleasure to host you all here this morning at the State House. And as Paul mentioned, today we are here to call attention to a terrific public-private partnership between Mass211, the 19 local United Ways in Massachusetts, Boston Children's Hospital, Greater Boston Food Bank, the Boston Public Health Commission, and all of these nonprofits, which clearly all of you are working so well together. Now, for those who aren't familiar, Mass211 is our Commonwealth's comprehensive information and referral hotline. This groundbreaking new partnership, announcing here today, brings together Children's Hospital, a new easy-to-navigate online search engine and a search platform known as HelpSteps, and the comprehensive Mass211 database. Thank you, Eric Fliegler, for working on this and coming up with this great innovation. That's what we are the home of here in Massachusetts. You're showing it and leading the way here today. This partnership will help create a very robust and easy-to-use tool, now branded as Mass211/HelpSteps. This new platform can be reached by logging into either helpsteps.com or mass211.com. Since 2006, Mass211 has been serving the citizens of the Commonwealth by providing free 24/7 information and referral services to anyone who simply dials those three numbers, 211. The United Way has also launched a very important effort to assist furloughed federal workers and others impacted by the ongoing government shutdown, which I have to editorialize. It's a shame that we have to do it, but there are there are families here in Massachusetts of workers who either are not working right now because of the shutdown, who are working but are not receiving a paycheck, who will need assistance if this keeps going in many areas to pay for their rent, their utilities, their food, etc. We need to be there to help them, so thank you. I would like to remind my colleagues in the Senate and the House to use Mass211 HelpSteps, the online platform, when responding to constituent assistance inquiries. This is a resource for our offices as well. If your office is unable to find help on their own for constituent callers, please ask the person to call dial 211 so a live professional who's been trained, information and referral specialist can help them one-on-one, 24 hours a day, 7 days a week, 365 days a year, in over 140 languages. That's pretty amazing. Yes, wow, that's great. So on behalf of the residents of the Commonwealth, I would like to thank Greater Boston Children's Hospital, Mass211, United Way, again, the Greater Boston Food Bank, the Boston Public Health Commission, all of the Mass211 staff, and the over 165 highly trained volunteers that operate Call to Talk for making this new service possible. I think this will be a leader not only for Massachusetts, but for the rest of our nation. So I'd like you to give them a round of applause, and I'd like to ask Paul to just come back for a minute so I can give him a citation too.
Oh,
so. So on behalf of the Massachusetts Senate, I'd like to give you...
Excuse me. Mother.
Yeah.
Come on up.
photo.
Thank you. I have an official citation, and on behalf of the Massachusetts Senate, I'd like to say official citation. It says official citation. Be it known, so it's official. Be it known that the Massachusetts Senate hereby extends its congratulations to Mass211 in recognition of the creation of the HelpSteps platform, connecting Massachusetts residents in need with health and human service resources. And be it further known that the Massachusetts Senate extends its best wishes for continued success. I know that that will be. And the citation is signed by the President of the Senate and attested, and a copy transmitted to the Clerk of the Senate. And it's dated today, January 16th, 2019. Congratulations.
Can we give the Senator a round of applause? It's now my pleasure to introduce a friend and colleague who has worked with us for many years to provide help with food security in Massachusetts. There would be a lot more hungry people in our Commonwealth if it weren't for the Greater Boston Food Bank. And it's my pleasure to introduce to you their President and CEO, Catherine D'Amato.
Thank you all for being here today. We're so proud to be a partner with HelpSteps. It is clearly an awesome and much needed tool, and want to extend our appreciation to Senate President Spilka and her team that's here today, to you, Dr. Kruger, for your innovation, your persistence, your drive. I don't know if your children ever see you, let alone your wife, but in terms of when people see this tool, I'm often asked, where did it come from? Who's behind it? So we want to thank you for that, Paul. Thank you for your leadership and the partnership with United Way, and Monica Vallis-Luby. Thank you very much. The Greater Boston Food Bank is embarking on, I think, a pretty tall order to look at trying to make Massachusetts hunger-free by 2028. And tools like HelpStep are critical in our ability to achieve that, to be able to refer, direct, inform, and to have all of the health determinants together is a very awesome reflection, I think, of your brain and what you have experienced every day as an emergency room pediatric physician here in Boston. So the research does show that adults suffering from food insecurity are at higher risk for illnesses like hypertension and diabetes and depression, and for children it truly impairs their growth and development. And for us, when we've looked at food security screening and the tool has this capability in it, it matters deeply to be able to confirm that that individual family is experiencing food insecurity, but more importantly, to direct them to the source, to give them the food. Healthy food matters, and healthy food will produce healthy outcomes. So we believe that if a doctor can screen that patient for food insecurity and connect that patient to food resources, it will have a positive impact on their health. We're currently using HelpSteps on Cape Cod to try to make the connection between a food pantry and a physician, and we're learning a lot about that handoff, not just in the determining that you are food insecure, but then being able to follow that particular individual or family. And that's going to matter deeply to our ability to see Massachusetts become a hunger-free state. We believe it can be, and we believe that with tools like this one, we're going to make a lot of difference, and just want to express our sincere appreciation. I don't want to lose sight that this shutdown that's occurring in Massachusetts does affect thousands of workers. It also is affecting Coast Guard workers down on the Cape and to the North Shore, and that families are beginning to need food when they never did before. So the tool could not come at a more important time to be able to promote it and to use the 211 network and to get families across our state the food that they need. I am deeply proud to introduce you to the creator of HelpSteps, pediatric emergency physician and health services researcher of Children's Hospital. Please welcome Dr. Eric Cooper.
It's an absolute honor to be here today, and I just want to thank you all for taking the time to be with us. So my name is Eric Fliegler. I'm a pediatric emergency physician at Boston Children's. and I'm the founder of HelpSteps. I'd like to take a moment to tell you why this tool came into existence. So I have been on the front line of caring for patients directly in the emergency department at Boston Children's for about 20 years now. And it won't surprise you to hear that there are children who come in with very obvious things, such as asthma attacks, lacerations, broken bones, and things like that we deal with every day. But one of the things that became very clear to me was that underlying so many of these conditions that they came into the ER with were social problems, and more specifically, unmet social needs that were affecting them. These are the types of problems such as food insecurity, as we've heard about, housing instability, issues of domestic violence, even at a hospital, issues of access to health care. And there was a girl who I took care of very early on in my career who's always stood out for me. She's a 7-year-old girl. She came in with a very simple finger laceration, a cut on her finger, not a big deal. And her mom said something to me that I found unusual. She said, Dr. Fliegler, when do you think you'll be done? Because I need to call DCF, the Department of Children and Families, for a lift home. And what struck me about that conversation is DCF isn't really kind of a ride service. And so I asked her a little bit more. And so she explained that her family had been involved with DCF for a while, but that recently she had lost her driver's license and she needed help. And I said to her, how did you lose your driver's license? And this is the story she told me. She had had epilepsy. It had been very well controlled for many years. But she had had a copay that had been added to her seizure medications that she had been unable to afford. And so for want of that copay, she had not gotten her medication. She had a seizure. And if you have a seizure, your license is revoked for 6 months minimum. Because she had her license revoked, she's unable to drive, she lost her job, and here she was. And there are services that actually exist to support people like this, but she didn't know how to access them. And so because of patients like her, I decided I wanted to do more. I actually did a health service research fellowship. I got my master's in public health. And the very first study I did was actually looking at families' health-related social problems. And I want to share some of the findings that we found. And this is back in a study from 2003, but it's been replicated over and over again across the country. 78% of the families that we surveyed had at least one major social problem they were dealing with. And 50% had 2 or more. These are big, big social problems. But those people who had been referred to services said it made a difference. And that was very striking, that going to the social services, which we hope are going to help, made a difference for them. And this is the third thing that we asked them. Would you be willing to use a computer system that could help you find services, whether it's in a doctor's office or somewhere else? And I will remind you, in 2003, this was before the invention of tablets, before the inventions of cell phones that could use the internet. This was like early. And 92% said yes. And so with that type of encouragement, I said, all right, we need to do more. And so I spent the next 12 years working with the most incredible engineers, program managers, partners here, the United Way, the Boston Public Health Commission, Greater Boston Food Bank, to build up the system. And trust me, it's gone through a lot of changes. It took a lot to develop it, redefine it, study it, make sure it works. And it looks like it does. And so I'm going to take the pleasure to show you what it looks like. So what is HelpSteps? It's both a web and a mobile-based tool. It's designed to connect people to social services. It can also be a screening tool if that's desirable. We have referrals throughout the entire state of Massachusetts because of our partners, both at the United Way and the Boston Public Health Commission, and because of the incredible phone lines that the United Way runs, as well as the Mayor's Health Line at the Boston Public Health Commission. If you can't find it through HelpSteps, you call them and you're going to get somebody 24 hours a day who will make a difference. And so if you go to our website, this is what you see. We want it to be very straightforward. You see nice big icons that say, these are the big social service categories that you can use. You can put in your location so it knows where you are and it'll help you find those services. Then if you click on, say, food, you see the very specific things. I need help applying for WIC. I need help finding food pantries. The phone numbers are always on the bottom left-hand corner so people know how to call them. When you click further, it starts to actually show you the names of the agencies, tells you how far away they are. And if you go ahead and you actually click on that, you can actually read about the agency itself, know who they're focused on, know where you can find them via this map, know all the services, know the languages that they support, and it's all there. As was mentioned earlier, we even built in a screening tool, and so we can actually screen families for social needs, and this is an example of what it looks like when you take the 2-question food insecurity questionnaire, so we can help you actually identify services. And while the families themselves, they may not say I need to be screened for that, but if there are organizations like hospitals, social service agencies, community health centers, they can use these screening tools with their families so that they can actually understand what are the needs of their patients, of their clients, and actually help identify what do we need to focus on. You can share this information readily, and this is probably one of the most important features. If you're helping a family and you want them to get the services, you click on the button share, and it gives you the option of sending them a text, sending them an email, or printing out a referral. I should be noted that if you're using it on your cell phone or somebody else, that text is not coming from your phone. They're not going to call you back. It's coming from our system. But the idea is we can give people access to the services that they need. I would also encourage people, get your clients, get your patients to download it, because the most important people who are going to help them are probably themselves. That's really, really key. If you print out a referral, you can see what it looks like. Our idea is to make this as easy to use as possible, to give people the information that they need. I have two engineers in the left-hand corner here who are smiling because they're the ones who designed that back 10 years ago. They can't believe it's still here.
Looks just as good.
Thank you. One of the really cool things that's happened with this partnership with the Greater Boston Food Bank is they said, you know what? We're willing to be a warehouse to connect people directly to the services of the food pantries, and we'll have them call them back. And so while it's still in development, we have this new tool called Connect With Us that will actually send a referral to the food pantries to help people further. It's just in one food pantry on Cape Cod so far, but our goal is to get it to the 500 or more food pantries that the Greater Boston Food Bank supports throughout eastern Massachusetts. And this is what it looks like. Language is important. We know that the languages throughout Massachusetts are numerous, and our system is now designed to operate in over 100 different languages. It does it flawlessly, and we've had colleagues who speak these different languages look at it and they tell us it's pretty good. Thank you, Google, for helping with all of that. Of course, it wouldn't exist if there wasn't a good app, and so this is what our app looks like, and I want you to see that there are 4 screens there. In 4 clicks, anybody should be able to find the services they need and call the services directly and get the help that they need. I'm going to finish with a story. So I told you the story about the girl with the finger injury. Well, this is March of 2018. I'm working the overnight emergency department, and one of our wonderful residents comes out and tells me there's a patient there with an asthma attack. The patient had been seen the night before, but the asthma was still bad. They explained what they want to do, and they said, I think in a few hours we'll be able to get them home. And I asked them, why are they back here the next day? And they said they didn't fill the prescription. And I said, why didn't they fill the prescription? And that's when the resident went silent and said, I don't know. So I walked in and I examined the patient, and we talked about what we were going to do. And I asked the mom, how come you didn't fill the prescription? And she looked at me and she said, I couldn't afford the copay. And so I asked her if she had a phone, and you should know that phones are an intrinsic part of everybody's lives. It does not matter what your economics are. We have to have phones to get along. And she took out her phone, and I had her download the app, and within 30 seconds, she was identifying places that she could go to get this type of help. She smiled, she started to cry, and she gave me a hug. And she said, this is exactly what I've been looking for. Thank you. And I think this is something we can help all of the people that we meet with, and I hope that we can make a difference together. It's been such a pleasure to work on this. It has truly been one of the absolute highlights of my career. I'm honored to be in a position, but I'm just as honored to work for everybody that we can all work together and make this difference. With that, I would like to introduce Monica Valdez-Lopez. Monica Valdez-Lupi. The Boston Public Health Commission has been our partner from the beginning. And without them working directly with us, we never would have gotten where we are here today. And I just want to say thank you to everybody for being a part of this.
Good morning, everyone. I want to thank, again, the Senate President Spilkin and her team for hosting us. I want to thank Paul, his team at the United Way and Mass211, to Dr. Fliegler and his amazing team at Boston Children's Hospital, the Greater Boston Food Bank, Catherine and her team, and I would be remiss if I didn't acknowledge our team at the Boston Public Health Commission. So we have our Bureau Director, Leanne Bethune, and Beth Baker and her staff from the Mayor's Helpline. So this wouldn't be possible, as everyone has already laid out, without a team and collaborative effort across all of these partners. On behalf of Mayor Walsh and all of us at the Health Department, I want to congratulate and thank everyone for getting us to this point where we're able to launch HelpSteps statewide. Healthy people build healthy communities, and we know from our work in Boston that all health is local, and we've talked about examples that we're piloting in the Cape and in Framingham and beyond. Building clinical and community linkages is something that we in the room and many of our colleagues across the nation are talking about, because we know that access to social services is really critical for improving health outcomes. But here in the city of Boston and in the Commonwealth, I'm really proud that we're not just talking about community clinical linkages, and we're actually doing something about this to go beyond our clinic and our healthcare institutions and back into our neighborhoods. Working together, you've heard about how we've built HelpSteps, which is really a powerful tool. I was hearing about HelpSteps when it was in its web-based format, when I was at the State Health Department, and then when I was in DC working with our state health officials. And it was so cool to see how the local health department was partnering with our nonprofits and with our healthcare partners in the city to create something that was really needed to help residents really at the neighborhood level and to empower them. And this is what's important about HelpSteps. It's just one of those tools, as you said, Dr. Fliegler, that patients and their families need to empower them to help navigate this really complex set of services that we have here in the Commonwealth. And HelpSteps is just one tool and one way that we're advancing our priority of achieving health equity at the local health department. All of our programs you saw a demo of it are listed in the tool, down to the contact information for the program and also the different languages that our staff have in terms of language capacity. And you've already heard Senate President Spilka and Catherine talk about the impact of these really challenging times with the federal shutdown. So I really think that now more than ever, a tool like HelpSteps is going to be critically important to helping everyone across the Commonwealth access important resources and services that they need now. And I'm really thrilled that we're here and have been able to work with Dr. Fliegler over the years to pilot HelpSteps, to get it ready for this statewide launch. And I'm really excited, and it's an honor to be with everyone today to roll it out statewide. So thank you for including us in this work. Look forward to learning about how it's helping residents across the Commonwealth access services, and to hopefully continue to build it out so it becomes a national tool. Thank you.
So, anybody have any questions? This is a very enlightened group, but I'm sure there's a question or two. Well, yes, miss.
How are you going to make HelpSteps available to everyone? How will you get people to know about it?
That's a wonderful question coming from my Naomi.
Future marketer.
Getting the word out is essential to this, and I rely on everybody in this room to spread the word. We've had incredible, all the partners here are truly spreading the word. We know historically that the Boston Public Health Commission handles anywhere from 8,000 to 10,000 calls a year on their hotline, and they will be telling people about it, and that they have workers out in the field helping with it. United Way, of course, through their website and through their hotlines, have close to 200,000 people a year that are in contact with them. They'll find out about it. The Greater Boston Food Bank, they are responsible for getting food to 350,000 people. So right there are some really good starts. But I'm hoping that we'll go beyond that, and we'll work with hospitals and places everywhere to get the type of attention it needs. Thank you for that question.
Plus, there's also, for those of you who are legislators in the room, as I'm told anyway, constituent calls are a big part of your work every day. And if that, is still the case, you really don't need to go it alone with these calls. You can refer people to the 211 HelpSteps platform, or you can have them call 211 if they can't access that well enough, if they can't navigate it well enough. Some people are just like me, they're phobic and they can't handle a lot of the technology, but this technology is really easy. I can even do it, okay? And if I can do it, almost anybody can do it. So I would just recommend that if you want to really get the best bang for your buck, use the tool, use the program. One of the reasons that we were created originally was to help you with constituent calls. So please do that. And then while you're thinking about it, you might think about giving us some money.
I would encourage everybody who works in this building to download the app and be able to use it. It's simple, it's friendly. If you're helping your constituents and you know that you have ongoing issues and you want to make specific referrals, it lets you even save it, so that these are my favorite list of things. You don't have to search for stuff. Find it as readily as possible.
Any other questions? Yes.
Do you have like plans to take it beyond Massachusetts, like other states nationwide?
To be very clear, I did not actually ask my children to be the plan. That's my son Joshua wanting to know if we'll take it outside. That is absolutely our goal, Joshua. We want to grow it. We're very, very fortunate. We've become partners with a new company called Beta Health that's really going to help us take this, we hope, nationally and work wherever we can across the country. United Way, as everybody knows, is a national organization, and so we hope to work broader with them and other groups as well. It looks like my third child has a question. Yes.
How are you going to speak international?
My family likes to think big. I don't know where they get that from. The international thing, Sonia, I think we're going to have to work on, but I suspect that social problems are not unique to the United States and that it's a good idea. We'll work on that together. Thank you.
Where is the app located right now for download? I noticed it's not in the App Store.
So it should most certainly be in the App Store. It's under HelpSteps. By the way, we're not.
I did a search, I couldn't find it.
It's there.
But if you are having problems, please let us know. On the HelpSteps website, it says how to find it there, but also just look up HelpSteps. The one thing that people realize, the App Store can be confusing. There's no space between help and steps, so that may be the issue there.
And if you want to access it, you can also go right to 211.org, and the search button takes you right to HelpSteps.
Absolutely. Are there other questions? Yes.
It's not really a question, it's just another thank you. I've been working at the United Way in Greater Plymouth County for 13 years, but before that, been involved in homeless services and substance abuse services, and the number of people calling, as you rightly point out, is just huge, and the frustration that they've had over the years of being bounced around from agency to agency, it's really nice to see where we're able to pick up the phone and say, here's where you can dial for the one place that you get the help that you need. And you know, it's not about the ego thing. It's kind of like, let's park that at the door and get people the help they need. This kind of a partnership, I think your only challenge is to be able to have elocution, lessons, to be able to name all the partners, kind of thank everybody. But it's a wonderful example of what we need to do if we're ever going to solve, and I think that's at the heart of all this, to solve the problems for individuals, not just to manage them on and on and on. Because people need help, and they need to get better, and they need to have their lives improved. They don't need yet another person telling them to call another place and another 5 places. So thank you, Doctor, thank you, Paul, and the other United Ways, and thank you, all the organizations that are involved in this. It's making people's lives so much better.
Thank you, Dennis.
One of the things that we know is that problems rarely live in isolation. And so while somebody may call because they have a specific problem, they're having trouble feeding their family, it is more than likely that they're going to have multiple problems. And the problems kind of come and go over time. That's kind of the nature of the beast. And so one of the goals is to try to get people to know about the website, know about the apps, so that as these problems kind of come and go, that they have as easy as access as possible. Again, it doesn't fix the problems. We're a tool for helping connect people to services, but we're hoping it'll make a difference.
Any other questions? Well, before we go, I just want to once again thank Senate President Spilka for hosting us and her team for making this so easy. I want to thank the team at Mass211 and our United Way and the folks at Children's Hospital for their outstanding support in making this a very good morning for us. And I just wanted to say, I look at, it takes a lot to impress me. I've been working with individuals of high net worth and people that have, lots of means for decades because I'm older than dirt. And when I met Eric, I knew that this was a partnership that was worthy of our involvement because he's a good man. Not because he's a pediatric physician, because he's a good man. And good men do good things. And I just want him to know that that wasn't lost in our relationship. And I'm very pleased and honored for our organization to be linked with Children's and our other partners, and I want Eric to know how much I understand anyway, how much of him went into this. So thank you very much, Eric. Okay? There's food left over there that we don't want to hoof out of here. So if you would like to have some, please do. And thank you very much for coming, and have a splendid day.
Catherine's